I'm Tara, your host, bringing you unfiltered conversation on life, love, and everything in between. Hit that follow button so you're always in the loop. And let's get started. Today, I'm so excited. We have Kristin Maas. She's the communication director at the Maas Clinic, a comprehensive aesthetic care center dedicated to quality patient care for facial, aging, and skin rejuvenation, including surgical and non-surgical procedures, which means you don't have to go under the knife to look beautiful. Hair restoration and complete line of medical-grade skincare products with locations in San Francisco and Lake Tahoe. The Maas Clinic includes its own fully accredited outpatient surgical facility, which means you can get the surgery there and they take care of you there at the Maas Clinic. And it also includes a clinical research center. Additionally, there's the Appearance Care Center, which is a state-of-the-art medical day spa offering non-surgical and minimally invasive procedures. But before we get into this conversation, I want to go through this little quick disclaimer with you. The opinions and the experiences shared in this podcast regarding plastic surgery are intended for informational and entertainment purposes only. They are based on personal perspectives and are not intended to replace professional medical advice, diagnoses, or treatment. Always consult a qualified healthcare provider or licensed medical professional to discuss your unique circumstances before making any medical decisions. Listener discretion is advised. So, Kristin, I am so excited to have you on this podcast. I would love if you could give a quick intro into who you are, what you do, and the Maas Clinic, please.
Hello. Good afternoon. Thank you for having me on your podcast. I'm very excited as well. Well, I am the Director of Communications at the Maas Clinic. Make sure that we are staying up to date with the newest products, procedures. I also manage our philanthropy, which is Beauty for Books, where we donate books and funds to underfunded public schools in the Bay Area. It's a wonderful program. We started it years and years ago, and Dr. Maas is the founder of that, and he is my husband. So we've kind of worked side by side on that. And in terms of the Maas Clinic, I think you covered it. We're facial plastic and aesthetic surgery. Recently just brought on a body plastic surgeon. Dr. Maas, Corey Maas, does the neck up, the body plastic, neck down. Well, he can do the neck as well. But so we have, fully comprehensive. And then you mentioned the surgery center, which we have as well. So we kind of cover everything under one roof, one umbrella.
So I have a question about the surgery center because I know women are always worried, like, who's going to take care of me? I don't want my kids seeing me looking, like I just had surgery. And do I have to hire a nurse? What do I do? Who's going to drop me? Who's going to pick me up? And I think a lot of our listeners would like to know about staying overnight at your surgery center.
Oh, okay. So we have a fully accredited surgery center. You can have your surgery there. And right adjacent to that surgery center is an overnight stay room. Patients can stay there more than one night. Typically, though, they stay a night. We have nurses that you can hire that we recommend. People do sometimes bring in a caregiver of their own. So there's flexibility with that. And then what we recommend if you're uncomfortable with having a family member take care of you, which often it's actually, in my opinion, better to not have a family member because they have a personal relationship with you. And when they see you looking a little differently, it can be alarming at times and they may react, unexpectedly. You just don't know how they're going to react to seeing somebody with bandages and things. And you're never scary looking or anything like that, but different. But we have a whole host of aftercare nurses that can come to your home. We have a wonderful woman who takes care of patients at her home. It's called the Tiburon Oasis. And so there's many options that you can look into, and we have referrals for all of that.
Well, that's wonderful because I know a lot of women are scared. Sometimes they don't do it because they don't know who's going to take care of them. So that's great. I would love to know all the things that you do because I know, this podcast is for women who are going through transformation in their life. And maybe they just got out of a marriage. They're in a marriage and they're trying to spark it up. Maybe they're just broke up with a boyfriend and they want to look their best. You don't have to go under the knife, although sometimes you can. You have the means and you want a drastic look, you can. But can you talk about some of the non-invasive things you do first, and then let's get into the more surgical procedures after the non-invasive? I'd love to know what you do at the Maas Clinic exactly.
Right,
and also
right.
weight loss.
Okay, so we have it all. I think something that's really important, and I think that my husband definitely emphasizes this, is, surgery, you have to manage expectations and within yourself as well. And you're not going to fix everything. So I think starting sometimes with minimal and then moving on to more invasive is a good plan. Focus on maybe enhancing things that you already love about yourself. So do you have to, maybe there's a feature you're a little unsure about. Our patients come in, I think a good surgery surgeon will suggest subtle enhancements. Maybe you just need a little tweak to the nose, or, it doesn't have to be the full Monte right off the bat. So I think that's important. And also surgery is not a fix-all for everything. It's not going to fix your relationship, your career, life challenges. Look at, minimally or facial plastic surgery as a journey to kind of look your best. And our mission at the Maas Clinic really is what we answer the phone. How can we help you look your best? And with that, if you look like you've had facial plastic surgery or plastic surgery, then we failed in some ways.
Right.
So it's all about a harmony, a balancing act of your facial features, body features, to just look your best, look refreshed, rejuvenated. So when you're going through a life challenge like a divorce, you don't want to all of a sudden look like a completely different person. You want to look refreshed. You want to look happy. And I think, taking steps from the minimally invasive to the invasive, depending on age, depending on the skin quality, because it's not also a certain age. Some people say, oh, am I too young for a facelift? I'm only 35 or I'm only 40. I thought women didn't get facelifts until their 50s and 60s. And that's not necessarily true. Everybody ages differently. Right. And there's no shame in getting a facelift younger or needing your eyes done at a different age. Some people may never need their eyes done, but need their neck done. So it's everybody's an individual. And I think approaching plastic surgery like that in general, that's that. And then I can step into kind of the injectables and fillers and moving in. Okay.
I think people would love to know, I think minimally invasive always makes someone feel a little more like I can do a little bit of this and that and see how I feel. So let's talk about fillers and Botox, and maybe your lips get thinner as you get older. Sometimes there's women who have too much filler in their lip. So love to hear about what you think about injectables.
Are a great way for preventative maintenance and for just sort of rejuvenation. You've got the Botoxes, the Jeuveau, Dysport, Xeomin. There's several neuromodulators or toxins, Botoxins, several names. They smooth the lines, the wrinkles. It's great. It's easy. Very little downtime. Again, you need to be with someone, a doctor or an injector that's experienced, whether it's a nurse or a doctor. Botox only lasts 3 to 4 months, sometimes 6, depending on the product. But again, if they're an inexperienced injector having an eyebrow way up here, or, it will drop your lids. It will go away. Nothing's permanent, but a great way to just give you a quick little pick-me-up. So all of the neuromodulators are excellent.
What about the lip flip? I know my daughter talks about that in her college. Girls are getting the lip flip.
Yes, the high school girls are coming in asking for lip flips too. It's very, very easy, simple, big trend right now. It's just injecting a little bit of the Botox or Dysport or any of the ones I mentioned, just right here above the lip. And again, we're on camera here, but we're not. And it just makes your lip look a little bit fuller. You're not actually adding volume from a filler, but it does raise the lip up enough to make it, it's a great procedure, fairly inexpensive, so the younger girls can afford it. And even young boys sometimes do this as well. You'll see with the models that are, males, they have filler and lip flips and things like that. So very common. We have a lot of lip flips these days.
Now, is it true, though, when you have a lip flip, it's hard to drink from a straw?
It is initially. So it'll kick in about 7 days, and then you have to get used to it, and then that actually goes away a bit. You started. So it's not the entire 3 to 4 months that it'll last or whatever. And everyone has, some people, products like that will last a little longer. Some feel like it lasts not as long, but it's typically a 3 to 4 month duration.
What about the fillers lift the face?
The volume fillers, Radiesse, Restylane, and Voluma, the Juvederm family, all of these companies have kind of families of products, whether or not you're trying to take away fine lines, whether they're around the lip or fill in your face. And yes, if you're putting in some fillers right around underneath your, let's see, like kind of in your eye bone there, that'll lift up your cheeks a little bit. You can restore volume in your temples. You can restore volume in your cheeks. Or in your lips, as you said. But there is, of course, you're needing to go to someone who's experienced, because right now, in fact, fillers are pretty controversial. They have been widely overused. Doctors are overfilling patients. And I think if you look, and I'm not saying many of the housewives are very beautiful, of course, but if you look across the shows and the housewives, there's a lot, they're starting to look a little bit masculine. So if you overfill your face, you can get a puffy look, maybe a jawline that isn't typical for a woman or a female. So you'll start to look a little bit more masculine. And I think that's not a natural look and not the look you want to achieve. So I think you need to be careful with fillers. And in some of the celebrities are now dissolving their fillers.
Yeah.
And that's where you'll see some need for facelifts at a younger age because the fillers are leaving skin sort of saggy.
Oh my gosh.
And I think that that probably will recover, but if you're filling your face up for years and years and years, you take out the filler, then what happens? And then, of course, the GLP-1s, the Ozempic, Wegovy, Mounjaro, those are causing people that are younger to seek facelift surgery.
Wow, that's so interesting. So it is true. I have asked that question before where I've had Botox because I love Botox. In fact, I've been doing it for so long, I think I'm immune to it. I asked that question. I said, if you get filler in your lips or in your face, it's like being overweight, like, will your skin not bounce back? And they're like, oh no, your skin will bounce back.
Bounce back depending on your age. So
Right.
I think, again, as an individual, some of us have more supple skin naturally.
Right.
Some of us have just fuller faces naturally, but there have been more patients coming in with dissolved filler. Their skin just looks a little bit loose and
Right. And yeah, what about, I'm kind of going off my question set here, but one of the people I've been looking at lately is Demi Moore. She just looks incredible at 60. Like, it's just insane how great she looks. But they did show a picture of her a couple years ago or a year ago, and she did look like she had a lot of filler in her face.
Agreed.
Yeah.
She absolutely looks fantastic now with just the awards she just won. And I think she went through where she was overdoing her plastic surgery, overfilling. I actually think she also had a thread lift of some sort, which pulled her up. I think everyone saw that picture where her
Yes.
looked
What was
very
that?
pulled tight. My guess there, and again, I cannot say for sure.
Yeah.
My guess is a thread lift pulled tight. Now, thread lifts don't last very long, so that's why that went away with her. Because if she was over pulled with a facelift,
Yeah.
a deep plane facelift, for example, that would last 7 to 10 years. Let's hope. So thread lifts will not last that long. So I think that's why that's my guess with what happened there. She
interesting.
She looks to have had quite a few procedures, but much more subtle, better facial harmony now. Looks beautiful and natural. Agreed.
Oh my gosh, she looks amazing.
Yep,
and then you try to find out who's her plastic surgery, but it's like
I think
taboo.
she's my guess is she's had several.
Yeah, just amazing. So one of the questions I had for you is, what is the most, now let's talk about more invasive surgery. And I have a couple friends who actually have requested questions. The first question I have for you is, what is the most common surgery women get today? I know that used to be breast. Is it still the breast?
I think breast, liposuction, sometimes the combination of both. And then, facelifts is, of course, for the aging face. Lip lifts are becoming a new trend, too. You talked about the lip flip. But a lip lift, because of the aging you get, that just alone can take off 10 or 15 years if you have the elongated lip and then suddenly you don't. It takes a little time to heal from. But I think, liposuction, breast augmentation, for sure. Eyes, too. I mean, they're all sort of, when you say common, I think everybody needs something different.
Right, that's true.
So
not one
I think
size
they're
fits
all,
all.
we're kind of busy with all facial and body procedures, depending on the body type and
right,
the person's trying to achieve.
Okay, so a girlfriend of mine said she wants to get her eyes. What is the surgery where you get your eye lifted?
Upper blepharoplasty.
Okay. And can you talk a little bit about that? That seems like, I have a few friends who have done that. That seems like a pretty benign surgery. Like you don't even see the scars like after 10 days. Right.
Yeah. The scar is usually placed right in your crease of your lid. That would be typically, you don't want to pull too much skin. If you pull too much skin, remember Liberace, he closed his eyes when he slept. So that's something to think about when discussing with your surgeon. If you're looking for an upper blepharoplasty, how much do you think he can pull? Because you may need a brow lift with it if you want to go higher. So, but yes, a blepharoplasty alone, 5 to 7 days. You can wear a pair of sunglasses. Minimal, it's still surgery, but the downtime and the healing is not very long on that.
And what about the lower lid?
Lower lip or lower blepharoplasty. Same thing, you need to be careful with how much skin you pull because you don't want the white part of your eye, that part, to be seen. You don't want that hound dog look, I guess is how it's described. So again, you may need a little fat transfer kind of in your orbital rim to balance that out. So I think combination, what I would say is combination procedures are really what helps you get that facial harmony or balance your features. So sometimes it's not just that. So if you're going to your surgeon and you say, oh, I really want my eyes done, I want an upper blepharoplasty, they'll say, well, I can only take this much skin based on the way you want an artist, right? Somebody, a surgeon who's an artist, I can do this much, I may need to do this. Now, again, not overselling, just honesty, saying what, patients, for example, will come in and say, I want this done. And my husband will often say, your lips are great or your eyes are great. You really don't need that done. What's actually causing the problem is your nose is a little long or your chin is a little small. So sometimes you're actually wrong, or not wrong, but your feelings of what you're seeing, there's actually a different way to fix them.
Because it's a harmony, like you said. The face has a harmony. And then your husband, Dr. Maas, he's able to see what how that harmony works. He can look at Right. And we have, what's nice is a mirror technology, and he can put your face onto a screen and make those changes. Now, again, the actual surgery is going to be a little different, but you can actually get a pretty good image of what you're going to look like, assuming you heal well without any, infections or complications, which are rare, but of course they happen in any surgery. You can get a pretty good picture of what you're going to look like. So that's very helpful. Called a mirror? It's called mirror technology. It's MI, just regular mirror, but it's just that it's the software. That is so interesting. And it's excellent. It's excellent. Sure you get a little picture side by side. Yeah, I'm sure people listening to this would love that. Like, they would love to see, what am I going to look like after this procedure? Right. Okay. Another friend of mine asked me, she says, my breasts are so big. She's 50-something. I don't know exactly. My breasts are so big. I don't like how big they are. I'd like to get a reduction. Can you please ask your friend, how difficult is the procedure? And she'd like to get a lift. Do I need an implant? I'm wondering if you know the answer to that question. And she also asked, how bad is that scar, that anchor scar? Will it ever heal, or does it always look like, pretty? So scars do heal. If you don't keloid or have an issue with, again, if you've never had a situation where you've had surgery and you're not sure, you could be one of those patients. Again, those are rare. But if you don't keloid, you're going to have a scar, but it'll go from purple to red to white. And you can, with the body makeup these days, you can disguise that. It's a scar. Right. I don't know how many people see us naked running around every day, but it's kind of how you look and feel in clothes. Maybe it's the goal. I think that the scar is probably worth it. And again, I don't think it's horrible. I think it's there. But it's worth it if you have sagging breasts. That's tough to deal with. It also makes you look larger than you are. Right. You could be very tiny and your breasts are just sagging and big, which will make your whole middle look bigger. Right. So, and you don't need an implant necessarily. It helps if you want more volume or if you have a lot of skin. So I think that would be determined by the surgeon at the time. But many people can do lifts without adding an implant. You can also do fat transfer. So you can get a fat graft, pulled from another part of your body and injected into your breast area. Butt. So you can fill in, there's several ways to fill, but I think sagging breasts, the scar would be worth it. Okay. And what about the recovery? Is it really hard? So the recovery on that is it's not hard. I think body surgery definitely, what's surprising with face surgery, most people don't even need to take anything more than Tylenol. We can prescribe more and we do, but you'll find most patients don't even take the heavier dose of narcotics. Body surgery is a little more painful because you're moving, you're having to get up, lift things. A couple weeks, and you're not in great pain. You'll manage your pain. You stay ahead of the pain with medicine, and mostly can be managed with Tylenol after a couple of days. So no, I don't think it's too difficult by any means. I've had a double mastectomy. And implants put in, and, first day was tough, second day, not so easy, third, fourth day, up and about, not that bad. Okay, wow, third, fourth day, up and about, that's amazing. You're a good healer, too. You're not going to raise your hand, you're not going to be lifting weights, 2 weeks out, doing jumping jacks. Right. But you can live it, you can get to work within a week or two easily. Okay, that's good. Yeah. That's good. What about that tummy tuck scar? I remember a friend of mine had the fat removed from her stomach, and the scar was huge. And the second night she came back from the surgery, she was just devastated. Yeah, that is
that is also, though, a scar that can be put in your underwear line.
Okay.
I mean, it can be. And so, again, if you heal well, that scar will eventually turn white. I think initially it might be disturbing, but again, I think the tummy tuck would be worth the scar, depending, especially if you have the twin flap. A lot of women who have twins.
Fufa.
The what is that? The fuva? What is that?
That's a new buzzword for women my age.
The fupa.
Yeah.
No one wants the fupa. But the twin flap, women who have had twins, they get that extra skin. It kind of separates. It almost, I wouldn't call it breaking, but it's sort of, you could do every sit up in the world. You would never recover. That would never make that skin taut or tight again, ever. So I would say worth the scar.
Okay.
Think about who sees you naked, and the people that see you naked are supposed to love you and care for you.
Yeah.
So I think that they should be okay with that scar as long as you feel better about yourself.
In a bathing suit or bikini to show off that nice flat stomach you now have?
Yeah,
or no?
You can hide it.
Yeah.
You can hide that.
Okay.
Yes.
That's good.
Yeah.
All right. This is a question that every woman close to my age asks. When is a good time? But I think you answered that earlier, and you were saying everyone's different. So I think I know what you're going to say. But when is the best time to consider a facelift or neck lift? And are there any signs you should look to decide when you're ready? Like, are there any,
I think that it's common anywhere from 40 to 60 common.
Okay.
I think the signs are when you no longer feel how you feel on the inside is no longer how you look on the outside. Okay. That might be a sign to just start exploring your options. And it might not be, like we talked about, there's an array of procedures you can choose from, minimal to surgical. So no time is really too soon. And I think if it's a good ethical surgeon, they'll tell you you're not ready. Right. And again, we're harder on ourselves, right? So I think women are harder on themselves than men are on us, right? We think, we look, and the men will think, I think you look great. Okay.
Right. That's true.
So I think that it really depends on how, again, skin quality. The number one thing you can do to stave off this is a good skincare routine. Yeah. That's the best thing you can do for your skin. And I think my husband will say everybody needs a solid skincare routine.
Oh, interesting.
That will help you. Even if you get a facelift, you're going to look better if your skin quality is better. So
what about Retin-A?
Retin-A, vitamin C, with the TGF beta factor, the growth hormones, PRP now, the platelet rich plasma injections, exosomes, those all need to be studied a little bit more, but we are seeing good results with them just on our own patients, long-term, maybe building, collagen, improving that all. But again, back to the question, so I don't go too farther off. I don't know that there's an exact time. I think some women never need some people never need facelifts. Never need them. Yeah. It just depends the quality of your skin, the thickness, how your lifestyle. Do you smoke? Do you, all of that? And then some people, that all can exercise. But then, women runners often will age faster. Just the skin, the running, the pounding. I do hear my husband, or he does suggest patients walk briskly. Running it can do a toll on your face.
And
so
your
you can
body,
usually spot a runner from a mile away.
Right. Oh,
he'll
interesting.
often say,
yeah, get rid of that endorphin high, trade it in for something else.
Yeah. Find a way, just a different way to exercise. Yeah.
Yeah. Well, okay. So this is something I know that a lot of listeners want to hear about, and that is the injectable, like Ozempic and all the ways to lose weight. When you hit 50, it's harder to lose weight, and now there's a solution. What are the pros and cons? Like, what are you seeing?
I mean, I think the pros are people are losing weight. They work. Yeah. Absolutely. And they have, 3 on the market. They're all the Wegovy, the Mounjaro, the Ozempic. They all work. Wegovy and Ozempic work about the same. Mounjaro has a little bit of a different mechanism of action, and I'm not exactly sure on that, so I'm not going to answer that exactly how it works. But right now, they don't see a lot of side effects except for the nausea, which that's really managed if you're with the right provider with the dose increase. So if you don't rapidly increase the dose, I think you can manage that. And they work right now. I think they're helping people with heart conditions. They're even having some studies are looking at Alzheimer's. And I don't know that they have enough studies to know what the long-term effects are going to be on people who don't have diabetes and who don't need these drugs. But they have been used in diabetics for a long time. So are there huge safety concerns? I don't think so. And again, I'm not a doctor or surgeon, but they are effective. People are losing weight rapidly, which in those cases, that's where you see the aging skin, the sagging arms, the sagging body parts. And yes, they are sagging face. People then will seek surgical intervention for that.
So it's kind of a trade-off. Okay, if I lose a lot of weight, then I have to worry about the skin.
Yeah, and it's the Ozempic face, right? That's what they call it. And Ozempic kind of has the trade on it, the trademark where, tissue, or, what is it that gets that, or what is it, tissue paper, is it, I can't think of Charmin. Everyone thinks of Charmin when you think of, so it's, Ozempic, they're all the same, the GLP ones, but they call it the Ozempic face.
Interesting.
So they're excellent. They're working. We have them in the office. Our nurse manages our patients closely. We try to titrate patients off, though, teach them healthy eating habits once they get that. And if patients can really develop healthy eating habits, better lifestyle plan with exercise, people can get off of these drugs as well.
Okay, that's what I was wondering, because it's like, okay, you use the drugs, you lose the weight, then you get off and you gain the weight.
Right. So our goal is to get you to the point where you can titrate off of this drug. If you don't need it for diabetes, we don't want our patients on it for the rest of their lives.
Right. Okay, that's good to know. One of the things I wanted to ask you is green flags and red flags. Like, when you're choosing a surgeon, what are the things that you should look for in your surgeon?
I mean, I think an automatic green flag is a surgeon who has a lot of experience for the procedure you're considering. Now, there are surgeons who do all procedures. So my husband focuses on neck up, so he's very focused there. I like
that. Because he's specialized. I don't like the surgeons that do everything, because then you wonder about them.
I think it's tough. I think if you're doing liposuction and breast dogs all day and then you do one face in 3 months versus if you're doing all faces or if you're doing all breasts. So I do think that that's important, but looking at their experience with the procedure, looking at their reputation, I don't think online reviews are 100% reflective of that, however, because you have disgruntled employees, competitors. There's a lot of problems with online reviews, and surgeons and our doctors they have HIPAA requirements. They can't actually say this patient is, not telling the truth. So, and they can't show pictures. And so they're in a bad spot there. But I think our best patients, for example, are referred to us by our best patients.
Right.
And so good communication with your surgeon, that your surgeon is communicating with you, that the staff is communicating with you, your questions are getting answered. Those are the green flags. Yeah. Red flags are surgeons who promise unrealistic results. You want to look like Angelina Jolie? I can make you look like Angelina Jolie. Or you're going to look 35 years younger. Or surgeons who don't take the time to explain the risks, the options. They don't manage your expectations, or they inappropriately manage expectations. Those are big red flags for sure.
Well, I think every woman, that's really good. Those are really good trips. I was just thinking, I think every woman is envious of a woman who's married to a plastic surgeon. Do you get that all the time?
I do, but listen, it's a glamorous job in terms of the outcomes, and everyone looks glamorous, but this is a serious business. Yeah. And there is not a night that goes by, or a day or a minute in my husband's life where he is not thinking about his patients. So if you are looking to marry a plastic surgeon, you come second. And I always say I have absolutely no problem coming second to his patients.
Right.
And he doesn't say that, so to speak, but if you're on his table or you're his patient, you want him to put you first. Yeah. And I'm guaranteeing you he does. And I live with that. And so, yes, it's great. And what's also nice about Corey is he doesn't look at me as a patient. In fact, I'm always like, oh, I need that. Yeah. And he's like, you look beautiful. He doesn't look at me that way. And in fact, he doesn't look at my friends that way either when we go out. Often people will say, oh gosh, I know your husband's looking at me. He's not. He'll look at you when he may in his head, but when you come into the office or have a consult, then but he looks at you as a person. And again, he's always thinking, how can I make you look the best? It's not always, gosh, this person's face needs to be taken apart and put back together. But
yeah, and I've been out with you and your husband, and he's always such a charming gentleman, and I never feel like I'm being scrutinized at all, and he's just really really thoughtful and easy to be around. So yeah, that's a really great quality. Very warm and kind and patient. So that's what you want in your surgeon, I think, patience.
Yes, patience, understanding, because healing is not easy. People, not that it's hard from a pain perspective, but you're altering yourself. So it takes time and patience, just even, skin resurfacing, which is excellent for, if you get a facelift, for example, if your skin looks better, it's great to get that combination. I talked about that. But that's actually more difficult to heal from than actually a facelift, because you have the drippy ointment to put on to help the skin heal. So sometimes it's even the more minimally invasive procedures that can be more difficult to heal from. But again, nothing's overly difficult. Everything passes, and in a couple weeks, you are so happy you made this decision.
Yeah, that's great. So Kristin, if people want to get a hold of you to maybe get some of these procedures done, what's the great way to get a hold of you?
So several options. To me personally, or the office?
Yeah, or the office.
I mean, anybody can call. I'm happy to share my cell phone. I don't, I can probably not on a podcast, but
right.
they can call the office and ask to speak to me. I can speak to them from an office phone. And of course, friends of friends I speak to all the time. So they can reach out to me that way.
Okay, great. Well, Kristin Maas, you've heard her here. Well, thank you so much for your time today. I really appreciate it. It's so fun having you on. And I know that my women friends are just excited to hear this podcast. So thank you.
Oh, it's been my pleasure. Thank you, Tara.
If you loved today's episode, follow the show and share it with a friend. Stay tuned. There's so much more to talk about. See you next time.